Hi, my name is Jan Bills and I own and operate Two Women in a Hoe. We are a landscape and garden business, so you can imagine that during the summer months that my body takes a lot of wear and tear. Well, just recently I had this episode and I was weeding at a client's home and all of a sudden I had this horrible pain in my back and I could barely get up, and immediately I panicked, but I thought I just had to get to Van Every to see Dr. Anna because I knew that I could possibly be in trouble. And since I had back surgery in 2006, I was very concerned. But remarkably, within a week or so time, I was better, up and running, and now I feel 100%. So I'm very thankful for KST and Van Every.
And she was really worried because of the back surgery in the past. So she kind of immediately went back to that, like, is she going to need surgery again? What is going to happen?
Yeah.
And within, I mean, you almost like after her first visit, she felt a huge difference and a huge relief. But it was also very emotional for her too, because you go back to that scare, like that scared feeling. So we actually worked on her emotions to let that release. So you made a huge difference.
Yeah, and I was really panicky.
Yep. And one of the things that she mentioned to me was she wished that she would have come here before the surgery because she didn't know, because maybe we could have prevented the surgery the first time too.
You could have prevented the surgery.
Oh,
I probably didn't need surgery at all.
Oh,
So
thanks.
anyway, I'm grateful for Van Every.
Yay! So let's get you adjusted.
Okay, sounds great. I do feel wonderful though.
Awesome. Well, we're just going to keep you wonderful. How about
Yeah,
that?
sounds good.
So we did get a little bit of an emotion, probably just actually what we were talking about, a little bit of sadness. And I like probably more so like the fact that she had surgery and she probably could have prevented it. So we're just going to adjust for that. When I'm working with a patient with emotions, the three main things that I look for, I always look for fear, anger, and sadness. And then if I have basically get none of those, we go to the chart, to the emotion chart, and get to a very specific emotion. So those are the general ones. And patients usually, when you say something, they know, they go immediately to that emotion. They know what's causing it. And emotions tend to really focus on the cranials and tend to kind of affect the brain too. So now we're working structurally to keep her back feeling great. When a patient's had surgery, a lot of times you actually have to work on the scar tissue. And this technique actually works really well with scar tissue because we can actually, I like to think of it as normal tissue moves like this, scar tissue tends to hold. And basically the energy has to go around it. So by getting it adjusted, we can actually tap into the scar tissue. Energy can go through it. It decreases the adhesions, it makes them feel better, it gives them more energy. So we see a lot of scars that hold a lot of damage. And by getting it adjusted, it actually can open up the energy to the scars. So when patients had surgery, you almost always have to adjust scars. At some point. I'm going to have you bend forward for me. A little bit more. Good. Come back up. And we're all done.
Great.